Good day. My name is Professor Glenda Gray, and I'm the President of the South African Medical Research Council. Today we're going to talk about medical science and biobanks. Biobanks are a large collection of samples of urine, blood, saliva, and tissue. Biobanks are integral to medical science. Today you're going to find out more about biobanks as you follow David around and begin to understand why it's important to contribute to biobanks and medical research.
Hi, is this the hematology clinic waiting room?
Yes, it is. Are you also here to see Dr. Bassa?
I am. She wants me to take part in a study, but I'm not really sure. Medical research scares me a bit. Why is it being done, and why do they need me involved?
You really don't need to be afraid. I've been involved in a study before and it did me no harm. If you feel it may not be safe for you to take part, then you don't have to. It's your decision to make. No one is forcing you. After they have explained all the goals, risks, and benefits to you, then you will decide.
But why did the doctor ask me?
Usually it is because you have an illness that they are trying to understand better in order to develop better treatment. When I had TB, I was involved in a study that was testing out new treatment.
But don't they already have a treatment for TB? Why do they need to do even more research on it?
There is treatment for it, but they're always looking for better treatment that has fewer side effects or has a better chance of curing us from diseases such as TB or cancer.
And is it perfectly safe to get involved?
There may be some risk. It depends on the study. Most of these trials have to be carefully checked by scientists and experts first, as well as a research ethics committee.
Oh, what does this committee do?
Before any research can start in South Africa, this committee looks at everything to do with the research, and if it's not safe for us, they won't let the research start. This committee is made up of scientists, medical doctors, lawyers, and members of the public. The committee looks at the possible risks and benefits for the people taking part in the study.
Risks? Benefits? What does all of this mean?
Sometimes there may be no benefit for the people taking part in the study, but it may tell researchers more about the disease and it may help them get closer to finding better treatment. The ethics committee looks at all these issues when making a decision. If for some reason something does go wrong and you get really sick because of the study, you will be treated and cared for because the researchers have insurance to cover your medical expenses.
But if there are risks, why would I take part?
There are different types of studies. Some may involve no risk, as it may only involve looking at your results or using some of your leftover blood for research. Other studies that are called clinical trials are studies that test new treatments for diseases. They may involve a certain amount of risk, but your doctor will tell you what the risks are, and you will also be carefully monitored by your doctor.
And is this only done here in South Africa?
All patients across the world who are involved in a clinical trial are carefully monitored by a local or international committee, and if there are any serious risks for the patients involved, then it is stopped.
I think I need to find out more about the study. Maybe I should go and see Dr. Bassa.
Hamba kahle. Good luck.
Hello, David. How are you doing? I understand you want to talk to me about the study we discussed. What are your concerns and how may I help you?
Yes, doctor. I'm still not sure. Could you maybe tell me more about the study before I make up my mind? What will I have to do and what will be done to me?
Of course, David, it's important for you to have all the information you need before you make your decision. The focus of this study is to collect samples for storage in our biobank. Biobanks are found all over the world and they collect samples that are used for many types of research. These can be samples that are left over after your usual tests are done, or with your permission, new samples that are taken from you. The advantage of a biobank is that it allows researchers to commence their studies immediately without the delay of waiting to collect lots and lots of samples.
Okay, but is it not bad for my health if you take all of these extra blood samples from me?
So, David, there's always a small risk for taking any sample, even for doing your usual tests. However, we follow international guidelines to ensure that your health and well-being are protected.
Okay, I understand, but why is it so important that I take part? Can't you maybe ask someone else?
Actually, we are asking people both from South Africa and other parts of the world to donate samples. This is to ensure that we have samples from different groups of people, as genetic information differs from population to population. So this will allow us to do many types of research, including studies that look at genes to understand why we develop certain types of diseases.
Sorry, doctor, what is a gene?
When a man and a woman make a baby, they pass on many types of instructions, like how a baby would look, the color of their eyes, and even what diseases they might get. This information is carried in genes, and they are passed on from one generation to the next. Differences in these instructions may decide why one person gets a disease such as cancer and another not. So it's very important for us to study these genes.
So that means that what you find out from my sample might even help my children and grandchildren. I like that idea. But does that mean my sample will be stored for a long time?
We're not sure what type of research we'll use the samples for in the future, but we want to have a collection of samples that's ready for the researchers to use.
This is a lot to think about. Would it be possible to go and visit a biobank?
Sure, I'll ask Prof. Bayomi now.
So David, this is an example of a biobank where we keep some of the samples that patients donate to us.
Thanks, Prof. If you don't mind, I'd like to have a look around and find out more about it.
Sure, why don't you come on in? David, this is Dr. Sanderson. She's the manager of this biobank that collects samples related to HIV and cancer.
Hi David, welcome to our biobank. When we receive samples, we put some of them in big freezers like this one. All of these samples can be stored for a long time.
Why is there a sticker on each sample? What does it say and can it fall off?
Each of the samples has a sticker with a written code on it instead of a person's name. This helps us to keep the person's information private. If this is your sample, we have no way of knowing that from looking at the sticker. It has no personal information on it, such as your name, age, or address. All of the stickers are securely placed. Any researcher who uses the sample will only see the code and not know that it's yours.
So no one will ever find out that the sample is from me?
No, not exactly. What we do is we have a different code for each of these samples. On this computer here, we have a file where we connect the code to your name. So if we wanted to know who donated the sample, we could go onto the computer and find that out.
Does this mean that anyone here in the hospital can find out?
It's very important, David, that we protect your privacy. So very few people in our team have access to this information. The researchers that get your samples will only be given this information if they really need to have it.
Why would they want to have this information?
Well, for example, they may discover something about you and your health from your sample, and they may wish to communicate that with you.
And who will you give my sample to?
Researchers who want to have access to your sample must apply to us in the biobank. They must also have permission from an ethics committee and a data access committee, and they must have a very important scientific question that they want to answer.
So who will you give my sample to?
We give your samples to researchers who are interested in carrying out research. They often have very important questions that they want to ask, but they must also have permission from an ethics committee and a data release committee.
So how long will my sample be stored for?
You can keep your sample here for a very long time, but if you wish for your sample to be removed from the biobank, you can request it and we can locate your sample and we can destroy it.
Really? It's as easy as that?
Yes, it is, David, because we have the information on the computer, so we can easily locate where your sample is and retrieve it and destroy it.
Okay, I think I understand that. But you must be making a lot of money from this. What about us who are giving you our samples?
This biobank is used for research purposes only. It is illegal for us to sell or buy human samples.
Okay, but how will I explain this to my family and my community?
It's very important for us that we keep the community involved. We meet with community members regularly. We call them the Community Advisory Board, or the CAB. And we have regular meetings with the Community Advisory Board. And we inform them about our research, and they ask us questions. And so it's a learning process between the two of us. So David, inside this room is a meeting of the Community Advisory Board, or the CAB. The CAB is made up of about 20 members of the community.
I've never heard of this. What do they do?
Well, the CAB meets about once a month with us, and we discuss aspects of our research and what we're doing in the Biobank, and they have an opportunity to ask us questions.
So you talk to them about your research?
Yes, we do. It's a really good way of getting their perspective on the research that we're doing in the Biobank. So it's a two-way communication. We tell them what we're doing, we give them results of some of our research, and they can ask us questions.
So you talk to them about your research?
Oh yes, we tell them all about our research. We give them results of the research. We talk about the activities going on in the Biobank, and they have a chance to ask us questions. For example, last week they asked us about samples that are going outside of South Africa.
I think I like that idea. It just makes me feel uneasy.
Yes, well, often we send samples out of the country. Not all tests can be done in South Africa, but more importantly, the research that we do nowadays is better done with large samples and with lots of collaborators around the world. So we send samples out of South Africa and we receive samples. So it's a two-way thing.
But how can you control what happens to the samples that go out of South Africa?
Well, the researchers that get samples from this biobank have to sign agreements with our biobank, and these agreements are very precise, and they control how you use the sample. So when someone takes a sample from our biobank and takes it abroad, they have to comply with the rules and regulations that we put on the agreement with them.
Okay, I think I understand that. Thanks for explaining all of this to me. It makes sense now and I feel better about the biobank.
That's great, David. I'm very happy to hear that. If there's anything else I can explain to you about biobanking, please feel free to ask.
Thanks, Prof. I appreciate it.
You're welcome.
It's very important to have people like David contribute to medical science and biobanks. If you want to be involved in medical research or contribute to samples in biobanks, please find out more about it from your doctor so that you can make an informed choice. We hope this video has helped you understand and that you're willing to contribute to medical science and biobanks.